You have probably heard of Singulair. It has been prescribed tens of millions of times for allergies and asthma. But the drug can trigger dangerous side effects. And we're investigating claims the manufacturer had evidence the drug could affect the brain decades ago, before the drug even went to market.
Mommy, help! I want to die!
Desperate cries from an 8-year-old boy.
I hate myself! I just want to die right now! Help me, Mom! I want to die!
Tics,
No, 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 no!
depression, and aggression.
I will kill all of you!
Suicides. Just some of the potential side effects few people would associate with an allergy and asthma medication.
I had a bad temper that I had never experienced before.
Katie Johnson describes a major change in her personality.
I was very short with my husband. I was very short with my coworkers.
She says dark, even suicidal thoughts began taking over her mind just weeks after she started taking Singulair. Those thoughts took her down a dangerous path.
I would be driving my car to work, and there were times where I can remember I wanted to drive my car off a bridge.
What happened when you went off Singulair?
It was like a switch went off, and immediately I was back to my normal self.
For Katie, side effects were a short episode. But for others, these little pills are behind a traumatic and confusing journey. What warnings were you given when you were given the drug?
I don't think any, just take at bedtime.
Singulair was prescribed to Cami Pawnee's son, Tyson, when the outgoing little 5-year-old who loved being a big brother began suffering from allergies.
He was having trouble breathing at night. I would hear him wheezing.
The Singulair helped.
Yes, he was able to go outside and run and play again.
She says at first it was like a wonder drug, but after more than a year of taking the medication, subtle changes started.
He would scrunch his nose all the time, shrug his shoulders, and he didn't seem aware of it when I asked him to stop.
Gradually, there were more changes. Tyson went from happy and active to angry and uncontrollable. The sound of his sister's voices sent him into fits of rage, and he started to hate school.
Which was odd. He loved school, was always a star student. He would scream before we'd get in the car. He would scream the whole way to school. He wouldn't get out of the car.
How big of a personality shift was that?
It was huge. This was not him. It would just be strange meltdowns over just random things like what color cup I gave him or what he had for dinner. And it would turn into tantruming loops for hours where you couldn't console him at all.
Desperate to figure out what was happening, Cami took Tyson to multiple doctors. One diagnosed him with ADHD. Others wrote off the symptoms or blamed his age. Searching everywhere for information, Cami was eventually directed to an online support group dedicated to the side effects of Singulair.
And that's when the light bulb went off, and I was like, that is it. That's our problem.
Singulair helps prevent asthma symptoms before they start.
At more than 30 million prescriptions annually, Singulair and its generic montelukast is one of the most prescribed drugs in the country. A decade after Singulair went on the market, warnings the drug could cause mental issues were included in the packaging, but not generally advertised.
Side effects are generally mild and vary by age.
In March of 2020, in a move that went largely unnoticed due to the pandemic, the FDA gave the drug a black box warning, its most serious warning that a drug may cause injury or death, stating, because of the risk of mental health side effects, the benefits of montelukast may not outweigh the risks in some patients.
Why, after 20-something years, are we just now putting this significant warning on this drug?
Attorney Kim Beck is connected to a number of lawsuits claiming the drug's manufacturer, Merck, had evidence more than 20 years ago, before the drug went to market, that it could affect the brain. In documents for Singulair's approval, animal testing showed 24 hours after a dose, the amount of drug goes down in the lungs, but actually increases in the brain.
These rat studies that demonstrate that this drug does pass the blood-brain barrier, and Merck had an obligation to at very least say, is this a potential problem? Do we need to study this?
So are you saying that Merck didn't do that?
Based on the information we have right now, it certainly does not appear that Merck did that.
And back in the 90s, before Singulair was approved to treat allergies and asthma, the manufacturer applied for a patent for the drug to treat a condition where blood vessels narrow in the brain. Why would the timing of that patent be important?
Merck was saying, hey, this drug may pass the blood-brain barrier and be able to treat cerebral spasms. That's 2 years before the drug first hit the market in 1998.
Taking a closer look at the new warnings on Singulair, one of the recommendations is to stop taking the drug immediately if mental health symptoms occur, which is what Cammie did with her son.
It is severe psychiatric distress when they stop taking it.
Cammie says when they stopped taking the drug cold turkey, Tyson suffered what she called extreme withdrawal.
He got to a point where I didn't know if I needed to check him in an ER. We had to put him in a car seat because his body was flailing out of control.
As Tyson's symptoms got worse, again, Cammie says doctors did not help.
I had a doctor laugh at me. When I brought him in, he was screaming. This was probably about a week or two after stopping. She dismissed me, completely just laughed at me, said that medication couldn't cause this.
We wanted to ask Merck if they've studied the effects of suddenly stopping the medication, but the company declined our request for an interview. The FDA told us evidence was not strong enough to recommend tapering off the dose. But reading through documents, we found the FDA investigated just 17 reports of withdrawal, even though the agency was told hundreds of people in a Facebook group reported suffering withdrawal symptoms. Most were children. You have the box warning that says stop taking immediately if the symptoms develop, and then you have Singulair users who say they went through withdrawals when they stopped using the medicine. Now, those are conflicting messages for people.
Right. You know, I think it is really, it's case by case. I think what's important to remember is to always, of course, include your provider or your physician in these decisions.
An expert on addiction and mental health, Dr. Aaron Wilson says doctors should monitor any medication changes because side effects can be mistaken for other serious conditions.
So if a medication is causing significant depression and anxiety, and we're over here like, hey, let's put an antidepressant on there, let's try to treat that anxiety, you end up kind of chasing your tail. And then maybe you get side effects from your antidepressant, and then you end up in this just huge kind of feedback loop.
Wait, let me get up first.
For Tyson, withdrawal was difficult, but the results astounding. You can see the change in his handwriting. This was just a few months after going off the medication. When I was talking to your mom, do you remember the time that we were talking about?
When I went crazy?
Tell me what you remember.
I remember me flipping out a lot, just not having control over myself.
Does that
stuff like
seem
that.
like you?
No.
Kick. Perfect. Tyson is now 9 years old, happy, active, and social. He says he could not have done things like ride a horse when he was on Singulair. Anger and a lack of self-control would have made him want to hurt himself or the horse. But those feelings are gone. How would you say you are now?
Now I'm better. I'm myself. I've got control of myself.
That has to be a big relief for you.
Yeah, it is.
Cammie now helps run the Facebook group dedicated to raising awareness on the effects of Singulair. The group that she says gave her not just information, but hope.
It was keeping me up at night knowing there's other families going through the same thing.
Hi.
You're not alone, and they're going to be back. You'll see that sparkle in their eye again.
We want to emphasize, never stop taking a medication based on what you see in a news story. Talk to your doctor. And according to the FDA, there are a number of safe and effective alternatives, and Singulair should only be used if other medications don't work. We do have a lot more information for you right now. You'll find it on our website, azfamily.com. Chris Pickle, Arizona's Family.